Hello everyone, I am Dr. Ashish Sangvikar and this is our new video on the topic of breast augmentation. In this video, I am going to talk about the breast implants, what are the different types of breast implants available, how do you select a proper breast implant and the size of breast implant and the frequently asked questions during the consultation about the breast augmentation with breast implants. Before I start, I would like to tell you that on our YouTube channel, we have many videos on the topic of breast augmentation and other surgical and non-surgical cosmetic procedures. If you are thinking about any other cosmetic procedure, you can watch this video. You will get a lot of information, so you can make a well-informed decision whether to go ahead with the procedure or not. If you like watching this video, please press the bell icon so you will get information about all our future videos. If you think these videos are informative and some of your friends or colleagues might be benefited with these videos, please don't forget to share this video with them. Breast implants are basically of two types: saline breast implants and silicone breast implants. Both these breast implants have outer core or shell made up of silicone, but in saline breast implants there is salt water or saline inside the outer core of silicone, while in silicone breast implants there is silicone gel inside. All over the world, silicone breast implants are far more commonly used than saline breast implants. Both the implants are safe, but saline breast implants, the feel of saline breast implants is somewhat different from natural breast tissue, and there is a problem of rippling, that the implant border is visible in breast tissue, that also looks unnatural. In our clinic, we exclusively use silicone breast implants. Breast implants are available in two shapes, round and anatomical. Round breast implants give fullness of both upper and lower pole of the breast, while anatomical breast implants gives more fullness in lower portion of the breast than upper portion. Naturally, most women have got more volume or more tissue in lower portion of the breast, and upper portion of the breast is somewhat flat. So logically they want more fullness in upper portion because that's the way they get better cleavage. So again, all over the world, round implants are far more preferred than anatomical implants, and anatomical implants are very selectively used by few surgeons. They are mostly used in women with small breasts and the breasts which has very less tissues, because in these breasts, since the breast tissue is very less, the round implants are more visible. The upper portion of the upper border of the round implants is more visible. That's why anatomical implants are preferred in these women. Surface wise, breast implants are divided into two types: smooth and textured. Smooth breast implants have got smooth surface. This is a smooth implant, while textured implants have sandpaper like textured or rough surface. Both implants are soft to touch and feel like a normal breast tissue, but there is slightly more incidence of capsular contracture with smooth implants. Now, what is capsule and what is capsular contracture? When we place implants inside the body, our body tries to form an envelope around the implants. This envelope is made up of soft tissues, and this envelope is called capsule. Capsule is formed in all women who have got breast implants, but in 3 to 4% of the women, the capsule becomes thick, and this condition is called capsular contracture. Capsular contracture makes your implant feel hard, unnatural, and there will be change in shape of the breast. We have to again consider where we are planning to place the implants. If you are planning to place the implants under chest wall or pectoral muscle, then both implants are equally good. But if you are planning to place the implants above the chest wall muscle or under the breast, then, as I said, the smooth implants have got slightly higher percentage of capsular contracture. So here in this plane, we prefer textured implants. Recently, few cases of anaplastic large cell lymphoma. This is a type of immune cancer. It's not a breast cancer, but few cases of this lymphoma have been detected in women who have undergone breast augmentation with textured implants. So nowadays there is rise in trend for use in smooth implants. Now let's see how we decide the size of the implants. In our clinic, we take into consideration three main factors. One, breast width. We measure the width of the breast and the thickness of the skin. Breast width minus skin fold thickness or breast width minus 1 to 1.5 centimeter gives us the dimension about the diameter of the implant. For a particular diameter, there are specific sizes of implants available. Like an implant of 350cc comes with a diameter of 11 to 11.5 centimeter. Thus, by measuring the breast width, we get a rough idea about the estimated volume or the size of the implant. Second dimension is distance between nipple to inframammary crease in stretched position. If this distance is somewhat around 6 to 6.5 centimeter, then we choose the implant of volume 300 to 350cc. If this distance is more, then we select a bigger implant or an implant with higher profile. Third parameter we take into consideration is the expectations of the patient. What do you expect from your breast augmentation? If you are expecting moderate augmentation which looks natural, then we select a smaller size implant or an implant with a smaller profile. If you are expecting a busty look or a more fuller look, then we prefer a bigger size implant or an implant with high profile. In implants, we consider two dimensions. One is implant diameter and another one is implant profile. Women with wide chest, we select implant with bigger diameter. A woman with narrow chest, we select implant with small diameter. Again, if nipple to inframammary distance is small, then we prefer implant with smaller profile or moderate profile implants. If this distance is more, that means there is more laxity of the skin, then we select implants which are high or extra high profile. Again, we consider the expectation of the patient. If somebody wants a busty or fuller look, then and the chest is narrow, so we select implant with small diameter but high or extra high profile. If the woman have got wider chest but she wants a natural look, then we select an implant with wider diameter and moderate or high profile. So the profile will be less if the expectation of the woman is to have a natural look, and the profile will be more, that is high or extra high profile, if the expectation of the woman is to have a busty or fuller look. I would like to emphasize one thing: all said and done, the selection of size of implant is a complex thing. You just cannot select a size of implant just because your friend has got implant of that size, because no two breasts are same and every woman have got different shape and size of the breast. So the best thing you can do is communicate your expectations with your operating surgeon and leave this decision of selecting the size of implants to him. During consultation, one of the commonest question asked is, what is the lifespan of the implant? Most companies give a warranty of 10 years with the implants, and they advocate to change the implants after 10 years. You can keep implants for a longer time, but then the chances of complications like capsular contracture, implant rupture increase. So it is always advisable to change the implants after the warranty period, that is after the 10 years. The procedure of changing the implants is not as complicated as the first procedure, because the pockets have already been made during the first procedure. You have to just open the pockets, remove the old implants, place the new implants and close it. How long the result of breast augmentation will last? The breast augmentation is very rewarding surgery and the result will last for many years. But implant is not going to prevent the normal age and hormone related changes in breast. One cannot predict the future, but in some women, breasts with advancing age, the breast will become saggy or droopy, and they might require breast lift surgery to maintain the youthful fullness, size and shape of their breast. Again, one commonly asked question is whether a woman can breastfeed after breast implant. Yes, breastfeeding after breast implants surgery is completely safe and women can safely breastfeed their children. The chances of breastfeeding remain the same unless and until the implant is placed through the incision around areola. During this procedure, there is chance that some breast tissue or some breast milk ducts might get cut. But in our clinic, we place implants through incision under the breast, that is inframammary incision. In this approach, the entire breast tissue is not touched, it remains intact, so the chances of breastfeeding remain same.